Good morning, my name is Mark Wells. I am here with my lovely assistant Lauren, who's helping me do this video. She's waving from back there. If you're watching this video, you've probably had an injury of some sort to your elbow or a muscle or bicep or something in that area. I watched a lot of videos on distal bicep injuries. I've had one, and I wanted to share my story along with some other people that have done theirs. Thank you very much for doing that. I thought it would be helpful to do my own. Seems to be a pretty common injury, or fairly common injury for people in their 30s to their, look like their mid-50s. Most of them in the 30 to 40-year-old group. Probably on the older side. I'm 51 years old and injured it a few days ago. What makes my video a little bit different is the fact that most of them were showing the recovery period after the injury. Mine is before. So my surgery is scheduled for next week, and I thought I would talk about the injury itself, and then there will be subsequent videos talking about my recovery after the surgery. So last Saturday, which was April 13th, 2019, was at work lifting something pretty heavy, kind of in an odd way. I was lifting a tire with my toes and kind of helping shift it this way. Arm was bent a little bit. Something right here snapped. It was very excruciating pain. I knew instantly something had happened. It sounded like a piece of canvas inside of my arm being torn. And there was another person sitting right next to me, and he actually heard it too, so we knew something was wrong. The pain was very burning, very sharp. I took off, went running down a hallway, and just kind of was trying to hide my pain. I was not sure if I had done a lot of damage, and I could still use my arm, and I thought, gosh, it just really hurts really bad. I went to wash my hands, and then I realized I couldn't push the soap on the dispenser, and that's when I knew I had really injured it. I followed up about two and a half, 3 hours later. I was in the emergency room. Both the emergency room physician and subsequently my follow-up with my orthopedic, they took about a 2-second look at it, and both of them knew instantly what had happened, which was a tear of the distal bicep from the elbow, which is right here. So from the diagnosis portion, what they look for, it's called Popeye syndrome of the muscles. I don't know if you can tell or not from this, but Lauren's going to help me here by zooming up a little bit. You can see this is my good arm, and the muscle comes through here, and here it's been severed and swollen. So right here is where the rupture occurs. It really just severs that muscle off from the bone, and it ends up here somewhere. You'll know it when it happens. It's very, very, very painful. And so here I am. Today is Thursday, so we're about 6 days since the initial injury. I still have swelling, and today's probably more sore than it has been. Okay, back up. And today it's probably more sore than it has been in some time. I don't know if it's because I'm using it. And everybody's probably wondering what I'm not doing in a sling. Both the ER doc and the orthopedic have said the damage is done. At this point, a sling, it only serves the purpose of keeping this muscle from retracting further up into my arm. So he said, no problem, you can just go without it. So I've been using my arm. I figure I might as well use it while I can before the surgery. So again, a lot of pain, tearing feeling, a lot of swelling. Popping noise. A lot of people complain of popping noises. You will have this Popeye syndrome. I don't know if you can see it here or not, but it kind of deforms this muscle up here when you compare it to the others. And that's really how they confirm the diagnosis. I also had pain back here in the back of the elbow, and this motion right here is extremely difficult to do. As you can tell, that just grabbed me a little bit. So that was a little painful. So that's my experience at the emergency room was nothing more than they gave me Motrin and sent me packing home and said, contact my orthopedic. I saw my orthopedic on Monday. They scheduled surgery immediately. They do want to do an MRI because of my insurance and the way it's working. It takes a little bit of extra time, but the MRI serves nothing more than it's for the preoperative planning. So my doctor needs that in order to find out where this muscle is. So when he goes to retrieve it, he can get it. The surgery is going to consist of drilling a hole here and put an anchor in there. And if you YouTube distal bicep surgery, you will see 2 great videos on the type of surgery that is required for this. For those maybe that are not opting surgery, my surgeon, Dr. Lowry, said that you can live a life with this injury, but you will lose, I think he said, about 30% of the muscle strength in the arm. I can't afford to do that. So again, I wanted to talk pretty much about beforehand, and right now it's just living with discomfort, swelling, and limited use of my left arm, which is what I injured. And surgery is scheduled for this Tuesday. I should be having my MRI, I'm hoping tomorrow or Monday. This is Easter weekend coming up here, so schedules are a little messed up. And I will have surgery Tuesday. I'm going to post some videos as I go along this journey here. I ordered myself one of those arm braces. It should be here on Monday for post-surgery. I chose to have one of those fixed ones because I don't trust myself in a sling. I'm always trying to do stuff and chasing a bunch of kids around, so that doesn't help, right, Lauren? Anyhow, so that is kind of my story right now. If you have comments or questions, leave them. I will be happy to entertain them as I kind of go through this journey, and I'm hoping the outcome is the best. It sounded like, from what Dr. Lowry says, recovery is very, very good, and I can be as strong as I was before. The only downside is it's kind of a longer recovery, could take up to a year, but I think most of the healing is done in 90 days to 6 months. So again, if you have any questions or comments, leave them with me. Otherwise, I will have another video here following shortly. Thank you.